Hey guys, Dr. Mike Silvestri here with Silvestri Chiropractic and Wellness in Newton Township, PA. Wanted to discuss today some facts about lung health and how to keep your lungs healthy. Obviously, the times that we're living in, that becomes even more important than usual. So the first thing I wanted to talk about, what's the basic function of the lungs? So the basic function, of course, is to take in air. All right, of course, in the air, there's many different gases. One of the most important ones for us is oxygen. When we take in oxygen, our cells use that oxygen. So the process of actually taking in air and breathing out air is known as ventilation. The second function of the lungs, so one is to take in and breathe out air. Okay, that's the first function. The second function, even more importantly, that intertwines with that, is gas exchange. Okay, what do I mean by that? Well, we take in air that has oxygen. The oxygen goes into our cells. It's needed by every cell in the body, so you can see why the lungs are so important. And then we breathe out carbon dioxide, which is a byproduct of our body functions, of our metabolism. So that gas exchange is super important. Once again, oxygen is needed by everything in the body, every single cell in the body. Another thing I wanted to discuss is what's the nerve supply to the lungs, and of course chiropractic care comes into this as well. So I wanted to show you on a spine here, what area of the spine supplies the lungs. This is your spine from the side, this is your neck up here, this is the back of your skull, just to give you an idea of what we're looking at, okay? So this area up here, this is called your thoracic spine. This T1 to T5 area up here is going to supply the nerves. In other words, coming out of your spine here are going to supply your lungs. So when it makes sense, of course, your lungs would be right in this area. This is called your thorax here. So when it makes sense, if one of these vertebrae were shifted out of alignment like this or twisted to the side like that, you see how that pinches on these nerves. And you see how that would irritate the nerves. And if that's going to your lungs, would it make sense that your lung function wouldn't be as good? You wouldn't be able to take as deep of a breath or even breathe out as easy. Or you may be more susceptible to getting lung infections, okay, like pneumonia, like bronchitis, like things like this. So essentially, the other nerve system supply the lungs we have to talk about, it comes from the brainstem, it comes from way up here, okay? That's more nerve supply to the lungs. Now, this area of your neck is extremely important because the brainstem is up there as well. So we got two areas that supply the lungs in the nervous system. One is this upper thoracic area, or the upper back, and then two is the brainstem. Okay, there's a nerve from there, and there's the vagus nerve that supplies that. Another thing I wanted to show you, this is an anatomy book that I have here for you. And this just further illustrates the nervous system supply, okay? So if we talk about this, this is actually your spinal cord. As you see, it says T1 to T5 here, thoracic T1 to T5. And essentially, this is actually your spinal cord right here. Okay, so you see all these nerves coming out of here. This is the trachea. This is the right mainstem bronchus, left mainstem bronchus. So you see how, and of course your lungs would be right here. You see how this nerve supply is extremely important. Up here is right from your brainstem, and you could see, and this is the vagus nerve right here, and that also supplies the lungs as well. And this gives a nice representation of the lungs here too. This is the right lung, this is the left lung. You can really see how your heart is in the center there. This right here is the primary muscle of breathing, which is your diaphragm. And there's actually two nerves that come down here known as the phrenic nerves. Phrenic means diaphragm. Essentially, that's extremely important as well. So that allows you to breathe. Again, the diaphragm is the primary muscle of breathing. This is one of the many reasons, of course, that getting regular chiropractic care could help your lung health. Because again, if these vertebrae are shifted out of alignment up here or up in your neck, that's going to irritate the nervous system and not allow your lungs to function as best as they could, and leave you more susceptible to lung infections. So I wanted to discuss that, guys. In future videos, I'll talk about some more details about lung health beyond chiropractic. We can discuss as well. But if you're concerned about your lung health, the first thing you should do is see your chiropractor for that reason. Get the nerve supply to your lungs as best as possible. So guys, again, this is Dr. Mike Silvestri with Silvestri Chiropractic and Wellness in Moon Township, PA. If you have any questions, just feel free to give me a call at 412-302-7526. Be sure to like this video, subscribe to my channel, and look for more videos on anything that has to do with health and wellness in the future. Thanks guys, have a great week, stay happy and healthy, and I'll see you soon.